everyone. As promised, this is our course overview for the semester. Wanted to take the time out to talk about, um, all the areas that we covered in the course. Review some of the assignments we had, and just review some of the goals that we had for this semester. As stated very early on, we started off the course. You read a article called "Learning Your First Job," and I'm going to end this recording talking about the importance of that article. I wanted to start the semester letting you know that at least one of your priorities, one of your first jobs that you should be focusing on is learning. That's how you'll be successful in this program. And that article talks about what all successful learners do. It talks about time management, note taking, how to engage your learning, how to do all your readings, how to really absorb content. I will strongly encourage you to touch back with that article regularly and frequently. Reference that article. I think you should begin every semester by reading that article just to prepare you for the things that you need to do to be successful. My goal for this program is to teach you um, social work and healthcare from a macro perspective, policies, payers, health system services, and I believe that many of you have learned a lot about healthcare delivery since being in this program. But my hope is to encourage you to consider healthcare social work or being a medical social worker. It's a very rewarding job. Healthcare social work usually encompasses a lot of areas: substance use, mental health. You learn about different diseases, different disease courses. You learn about macro or CAP areas such as healthcare service delivery, budgeting programs, payers, and so forth, quality of evaluation of healthcare services, etc., and overall public health. And so we started off this course talking about public health and population health, really understanding epidemiology, understanding how to be interested in health of populations and how social work plays a role in the history of public health. And we also talked about some trends in healthcare related to diseases, related to health disparities, so forth. We took the time for this course to focus specifically on COVID-19 because this is the biggest pandemic of our time, and I believe it will be the biggest pandemic for some time. This will be something we're going to be talking about, scholars, researchers, and academics for some time to come. And I think preparing as a country, as the world prepares and braces for this, we are going to be a smarter, uh, um, health conscious culture because of this. And so now I just want to talk to you about that. The focus on COVID-19 was very important for me in this course because it allows you to understand healthcare from a macro perspective with an actual public health crisis. And I also think it's important to focus on COVID-19 because if you decide to embark upon a healthcare career, this is where all the literature, this is where the focus is now. Right now, it's a vaccine now, and we're talking about the second wave. But if you were to interview for jobs, I want you to be able to know and understand what the current literature is saying about COVID-19. So your first paper, your healthcare technology paper, talked about technology and use of technology, and I wanted you to include how that technology can help improve COVID-19. Because again, if you think that you want to go into medical social work as a career, these are the things that they're going to want to know, that you've thought about, and that they want to know that you're savvy, you're knowledgeable about COVID-19 across the spectrum. And so I wanted to make sure that you focused on that for all your papers, and that's what we did. We talked about U.S. healthcare systems and the different levels of care: primary, tertiary, primary, secondary, tertiary. We also talked about the role of providers, different interdisciplinary providers in healthcare systems. We also focused on health disparities, and those difference in healthcare outcomes related to diseases, and how people of color and poor people tend to bear the burden of those poor outcomes, and oftentimes how that's related to social determinants of health. We also talked about healthcare reform, particularly related to ACA. And your midterm paper, really was about understanding the political climate and how politics plays a role in healthcare. And so you wrote very good papers about Medicare and Medicaid, and how ACA impacts Medicare and Medicaid, in your midterm paper. And that is important because one of the biggest payers for healthcare is Medicare and Medicaid. And they serve vulnerable populations. So understanding the role of Medicare and Medicaid in servicing vulnerable clients and hopefully impacting health disparities, particularly related to COVID, is important. We also covered quality and oversight functions of healthcare, making sure you're evaluating healthcare systems to make sure that the service providers in the healthcare systems are providing the highest quality, hopefully at the most cost efficient manner. We also talked about value-based models in which we are hopefully incentivizing providers for outcomes rather than quantity of people seen. And then we talked about healthcare planning and what that looks like in healthcare systems. And we also talk about the importance now and focus on prevention and wellness. Because what we do know is that costs of healthcare are decreased when we keep people well, and we spend more money when we're treating disease and illness. Also, how healthcare reform and the focus on healthcare reform is putting more focus on prevention and wellness. Other areas, we talked specifically about maternal child health and some of the major issues in maternal child health, with emphasis on health disparities when it comes to women of color, maternal mortality, morbidity, and low birth weight and premature delivery of children or infants, mostly burdened by African American women. And we talked about some of the reasons for that as well. We also talked about HIV and HIV policies, how that impacts um, um, population health, and also wanted to remind you to really think about going back to that section and really thinking about taking that certification in HIV. Again, it's something that will be very useful on a resume, and it gives you another additional skill set. Um, all the content that's on Blackboard will be available for you for some time. Please consider going in the different weeks and downloading some of the content there that you think that might be helpful for you and be useful for you for the rest of the program. Start creating your own library of resources that you may want to refer to. Even if you bookmark that resource page where the HIV and HIV policy certification, that's important. Again, I strongly recommend that you take your time and over your holiday break or different breaks that you have in between the semester, take those modules and get that certification. I think that will be helpful. HIV is our other pandemic that has taken a back seat to COVID-19, but we've been dealing with that pandemic for some time. We also talked about public health advocacy and what that looks like for social work, and our roles as being advocate for public health in systems, and doing that public health advocacy from a system macro standpoint trickles down to services to patients that we serve. And then we also talked about ethics and social work and the importance of the role that ethic plays in healthcare and delivery of service. It really outlines the type of care that we provide as social workers. And I've also made sure that you had resources that govern standards of practice for healthcare. One was the technology standards. We also talked about the importance of documentation, and we also covered healthcare setting standards by the National Association of Social Workers, because those are also key documents that you need to know and understand. That we do have practice standards that govern how we behave ethically, appropriate, and high level quality services to the patients that we serve. And then we had the global health paper toward the end where we explored COVID-19 from an international standpoint. So a lot of the work and assignments that we did were looking at the COVID-19 from a United States perspective and standpoint. And that final paper was to compare to see how another country is dealing with COVID-19 and comparing the difference between other models and how COVID-19 impact different countries and how those countries respond, so that you can compare and get ideas of things that may work um, here in the United States, or you may see where other countries did a better job of keeping down the infection than what we did. And then another assignment that we focus on is health disparities. So please understand that the areas that you talked about in your papers and your assignments are hot topics in healthcare. You know, how technology is improving outlooks. Even now, we're doing those. We're utilizing more of those temperature check scans more than ever because of COVID-19. That's a healthcare technology. And you talked more at length about the different technology and how it can be used to improve COVID-19. But healthcare technology is going to play a big role in healthcare. And it's continuously changing, and new innovations are becoming available every year. And so staying abreast of that is important in healthcare. Health disparities is a big area right now, and an area in which we're going to try to improve, in which we haven't done a good enough job closing that health disparity gap. But again, another hot topic area in terms of population and public health. Understanding healthcare systems and services and payers is an ongoing process. Um, and lastly, understanding global health. We don't do a lot about a focus on global health in the United States, but there are many researchers that continue to keep their eyes and policy analysts to keep their eyes in other countries to get ideas of how to improve and work collaboratively with other countries to improve health outcomes in the United States and abroad. And again, I want to close out, referring again to learning as your first job. Please be mindful. One of my goals here is not just to teach you healthcare, social work, but to make you better professionals in the field. So please think about the assignments and the high quality standard that we had for your academics um, is consistent with improving your skills as a social worker. How? You had an assignment where you gave a presentation, a public service announcement. It was understanding how to present content related to healthcare, trying to improve health outcomes, particularly related to COVID-19, and understanding how public health law or our healthcare, Obamacare or ACA health reform, or our new healthcare law of the country, how that it can help improve COVID-19. That was an assignment, a content assignment to help you understand how the healthcare or ACA can improve health outcomes. But the second part of that assignment is how do you deliver a professional presentation and how to work within groups to do that. How to problem solve in groups in order to do a presentation like that. So that was helping to improve your presentation skills, which you're going to utilize in the professional world. Also, APA format is very important, not just for academic writing, but it shows your ability to understand how to apply a format to your writing, following instructions, understanding how to apply concepts, ideas to your work and your writing. So it's not just about APA writing in terms of the format, but understanding how to use a format and apply it. That's going to be important in your professional career because you'll be learning new models of service delivery. You'll be learning different theoretical approaches and models. You'll be learning different policies. And how do you take those policies and apply it to your work? The same concept with APA format. How do you take a format, a perspective? How do you take a model and apply it to your writing? So it's hoping to teach you a skill, and so being proficient at it is important, not just in the writing piece, but also in demonstrating that you can take a concept and apply it. The other piece is your assignments, understanding where to go for information. Rubrics are helpful in your assignments, but when you start your work, you're not going to have a rubric. Every issue that you deal with is not going to have assignment instructions and rubrics. So teaching you how to be independent thinkers, and hopefully the discussion board help with that. COVID-19, no one saw it coming. And we had to learn about it in real time, research it in real time, and learn skills of our respective discipline to help combat this. And so, in that same spirit, please understand we're trying to grow you academically and professionally to be independent learners. So yes, many assignments do have rubrics to give you an idea of how you're going to be graded. Assignment instructions give you an idea of what to write about, but don't rely too heavily on those either. Learn to think critically, learn to think um, in a way that you're applying concepts, because as you start your career, you will not necessarily have that level of guidance and support and instruction. You're going to probably get an employee handbook, and you're going to get new employee orientation, and you're going to be expected to hit the ground running, utilizing all the education that you've learned here. Again, not with rubrics and not necessarily with assignment instruction for everything you're expected to do in the work world. And other areas to really think about is, time management so that you submit all your papers on time. When you're working in a professional standpoint, it's going to be basic expectation that you're going to be timely with your paperwork. That's your documentation and reports. And so we have high standards here for that very reason. Again, not just that you get your work inside on time, but also so that we teach you those professional skills that will be expected in the field. So think about how the semester went. I know everyone was online, um, but you learned and you grew. I heard through many students that online is not their preference for learning. Well, in the next 10, 15, 20 years, there are going to be more online training formats. There are orientation that's done online. Because of COVID-19, a lot of education and professional development is moved online. So you still have to be competent regardless of the learning format. And so I say that learning online and being better with your work online is a good thing. And so if you've been successful this semester, pat yourself on the back because you've challenged yourself. If you were uncomfortable about learning format and you were successful, again, pat yourself on the back. You have to learn to be proficient and flexible as a professional social worker. You will be asked to engage in activities, and you may be assigned tasks that are not in your comfort level, that do not speak to your areas of strength, but there's still a level of proficiency that will be required as a professional worker, regardless of the format in which you're expected to work. There are a lot of models of telework now that were in place well before COVID-19. And so understanding how to deliver services and learn and grow as a professional in online formats is just as important today and in the future as it is with this change with COVID-19. And so I really urge you to really understand that you being successful and this challenge of learning online that was presented to you this semester is a good thing, and can be a good thing for you if you look at it in the right context. It just allowed you to grow in a skill set um, that you may not have thought you had. And if you thought you weren't good at it, if you were successful, you're probably better than you thought. So as you move along through the program, depending on where you are, really think about time management, think about work-life balance, and correcting in real time to be a more successful student. That is my words to you. And I do want to take this time to thank you for a challenging semester. I really enjoyed teaching you this semester, looking at your papers and seeing you grow from the start of the semester to today. I continue and encourage you to continue your growth. And I look forward to seeing you in the future as a MSW colleague. Um, I am pretty sure at some point we will be face to face for instruction. Um, I do believe that we'll probably be using the summer to really figure out how to come back safely in the fall. So I know it's just a matter of time before we all see each other face to face again. But we do need to make sure, and you probably know better than most students just by taking this course, the impacts of COVID-19 and the importance of public health and maintaining safety for all. So thank you very much for your time, and enjoy your holiday break. in the holiday season.